Before going into the patient's room, I would check the need for Foley care and then make sure this is my right patient, and then look for any allergies or any PPE precautions. Hi, my name's Alyssa. I'm going to be your student nurse today. Can I please see your bracelet? Can you tell me your full name and date of birth?
John Smith, May 10th, 1982.
Alrighty, Mr. Smith. So today we are going to be doing Foley insertion and removal. So I would start by raising the bed up all the way to waist level, putting the side rail down, and I would perform hand hygiene. Alright, Mr. Smith, I'm just going to pull your blankets down below your feet. And then we're going to pull your gown up to waist level. And then I perform hand hygiene again. And we're going to start with pericare, so I would put on clean gloves. I would get soap and then warm water in this bucket. And Mr. Smith, we're going to start off with pericare. I'm just going to make sure you're all nice and clean before we start this. When providing pericare, I would use a different part of the towel each time. I would start by circling around the meatus and then working my way down the shaft and then around the scrotum and getting the thighs. And then I would use a new washcloth and then I would just pat everything dry. Alright, Mr. Smith. Can you please just separate your legs for me a little bit? And then I perform hand hygiene again. And then, Mr. Smith, are you allergic to any like latex or iodine?
I'm allergic to iodine.
Alrighty. So I would open up this kit, making sure it's not expired. And then, Mr. Smith, I'm just going to place this here using this as a garbage bag. And then I'll just make sure that I'm opening this away from me. And then first I'm going to start off with putting on my sterile gloves. And just making sure there's no tears or rips in my gloves. And then, Mr. Smith, I'm just going to lay down 2 pads just to keep your bed from getting messy. And then I would make sure that the shiny side is down. And then if he could lift up his thighs or his hips, I would have him do that so I can get it under him better. And then, Mr. Smith, I'm just going to drape this one over you. And because my patient is allergic to iodine, I would throw away the iodine and then I'd use hydrogen peroxide. I'd open it, pour it over my cotton balls, and then I would just make sure that they're all getting saturated in the hydrogen peroxide. Then I would open up my lubricating jelly, squeeze it all into here. And then just putting the tip of this in the lubricating jelly. And then I would take my syringe, open it and have it connected so that it's ready. And then I'm going to start off by cleaning I'm gonna take one cotton ball, and then if he was uncircumcised, I'd make sure to retract the foreskin. I'd go around the meatus, down the shaft, and then around to the side, around again to the top, and then around the other side. And then the last one, I would just make sure I'm getting in the opening. And now I'm gonna start inserting. I would tell the patient to take a deep breath. And then for the male, you insert it about 7 to 10 inches. And then you should see urine coming out at the 7 to 10 inch mark. And then you put it in 2 more inches after that. And then once it is all the way in, I would slowly put the water in the balloon. And then I would just tug on it a little bit to make sure that it is in place. And then I would remove my gloves, perform hand hygiene. And then I would put on a pair of clean gloves. Okay, not those ones. And then I would make sure to hang the bag on the side of the bed below his bladder. And then if we were to get a urine sample, since I did just put this catheter on now, I can get it straight from the bag, but if he has had it on for a couple days, I would clamp it, I'd clean there, and then pull it out with a syringe. And then I'm just gonna secure this to his leg. Before doing this, I would make sure that this stuff is all thrown away. And then I would just make sure that it's not too tight, like 2 fingers could slip in. And then I would use this to secure it to his leg. And then that's it for insertion. So now I'm gonna do removal. When doing removal, I would perform hand hygiene again, put on a pair of clean gloves, and then I would put a chucks pad underneath. I would also put a chucks pad on the floor and empty the bag. I would measure it at eye level in the graduated cylinder, checking for color, clarity, odor, and amounts. And then once I empty it, I'd put the bag on the chucks pad. I would remove this off of his leg. Alright, Mr. Smith, so now we are going to remove it. I would have a clean syringe to pull out the water from the balloon. We would let gravity pull it out, but for time purposes, I'm just going to draw it out. Alright, Mr. Smith, we are going to pull it out on the count of 3. I just want you to take a deep breath. Ready? 1, 2, 3. I would just make sure I'm doing it slowly and coiling it in my hand. And then I would put it on the chucks pad, and then I would roll everything away from him, throw it away. I would take my gloves off, perform hand hygiene. I'd make sure his bed's in the lowest position, he's comfortable, his blankets are back on, and his call light is within reach. Is there anything else I can do for you, Mr. Smith?
No, thank you.